and good evening, everyone. My name is Christine Gan. I'm your moderator for today. Welcome to our BBMC My Neighbour community talk. This talk is brought to you by Bayang Baru Methodist Church. And, we are pleased to have Dr. Eunice Han with us tonight. The topic of tonight's talk is how to care for your child's teeth. Let me give you a brief introduction of Dr. Eunice Han. Dr. Eunice Han earned her Bachelor of Dental Surgery from the Penang International Dental College. She furthered her postgraduate diploma in orthodontics from the City of London Dental School. She's also a member of the Faculty of Dentistry from the Royal College of Surgeons, Ireland. Dr. Han currently is working at the Penang Adventist Hospital as the consultant general dentist. So let me just inform you some housekeeping rule before I pass the time to Dr. Han. Please turn off your mic during the whole session when Dr. Han is sharing her talk. We would love to have questions from you, so feel free to turn on your mic and unmute your mic to ask your questions after the talk, or you can also type your questions in the chat box. So without further ado, I'll pass the time to Eunice.
Hello, a very good evening to all of you who are attending. We are very glad that can see quite a few people are spending their precious Saturday evening attending this talk. So I hope that this talk will benefit you no matter how old or how young you are. As we know that over the years, as Malaysia is developing, the awareness among our general population regarding dental care and healthcare has greatly increased over the years. So we have come a very far way from the past and previous generation where most of the problems are solved by extraction. You know, like when you have pain, you go to the doctor, you extract a tooth. Okay, so nowadays, thanks to the accessibility of healthcare and the dental care, many other treatment options are available to the public, no matter from a private practice or from the government practice. Many other treatment options other than extractions to solve dental pain are available to the public. So as we know, God only gave us two sets of teeth, right? So one set of teeth, we call it the primary dentition. So during this talk, I might use certain medical terms, which I will clarify now. So the primary dentition is the baby teeth, as we know as the milk teeth. So the gigi susu, the milk teeth is also called the primary teeth, or the deciduous teeth. Okay, so sometimes I might mention the deciduous teeth. It means that it's the baby teeth. Okay, so sometimes I might use baby teeth, the primary teeth. So that belongs to the first set of teeth. So the second set of teeth where God gave us is the permanent teeth, where it starts erupting at the age of 6 to 7, and it will last you until you're 60, 70, and 80. Okay, so we only have two sets of teeth. That is why it's very, very precious. So we have to take good care of our teeth. If not, when it gives you problem, you know, most of my patients say they can bear any kind of pain except dental pain. Okay, dental pain is something that is, they say, it's out of this world. You know, when you have a bad toothache, you just want to like knock your head against the wall. It's that pain. Okay, so how can we prevent and take care of our teeth to prevent the extent of pain or the extent of damage that it might cause us? Right. So today's talk mainly will be based on oral health care of the younger children, starting from birth, that means age 0 up to age 10 to 12. So no matter you are a parent, a grandparent, or you are young, you're listening to this, you will benefit from this talk, because most of the oral hygiene measures that I'm going to share, most of the tips of how to eat sweet food and not get cavities can be applied no matter how old or how young you are. All right, so let's get started. I will start with a younger age group first. Okay, that means I will start from like the eruption of the baby teeth. All right, so as young parents, I see a lot of excitement when you see two small teeth budding out of their gums, right? Then this is where young parents take photos, hashtag new teeth, baby teeth. So this brings a lot of excitement when the first teeth erupts. We know that the first teeth erupts around the age of 6 months to 9 months. Some kids' teeth erupt much slower, but it will eventually come out by 1 year old. Okay, so let us look at the sequence of eruption. That means what is the sequence of the teeth coming up into the oral cavity, that means the mouth. Okay, so you can see here, let me get my pointer. As you can see here, number 1 is the first 2 front teeth on the lower. Number 2 is the 2 front teeth on the upper. And then the side ones, the laterals, number 3, and then the lower, number 4. Okay, so the first 4 teeth on the lower and the upper will come up first. Then after that, it doesn't bring any more excitement. Nobody remembers how the molars come out, how the back teeth come out, how the canine come out. Nobody else, no parent will remember. Okay, so in short, your child, your baby will start teething at 6 to 9 months, and they will finish around 2.5 to 3 years old. They will have their full set of 20 little baby milk teeth. Okay, so a child will have 20 milk teeth up to the age of 6 years old. Then the adult teeth will start coming in. So we always see some common symptoms of teething. Okay, so the symptoms of teething has been told to us by our parents and our grandparents. Oh, you have to do this and this to avoid your child having fever during teething, or how to handle a child when they are teething. Okay, so some common symptoms of teething will be they drool a lot. That means they salivate a lot of saliva. Okay, and then they are irritable, they tend to cry a lot, and then they have red and swollen gums. They refuse to eat because it's very uncomfortable. Some might have trouble sleeping. Some will try to grab anything that they can find, toys or anything, and put in their mouth just to soothe that irritation on their gum. Okay, some might have rash around the mouth area, and I like to explain about this. If your baby is having rash around the mouth area when they are teething, it's mainly because their saliva has actually food remnants in them. That means their saliva has little food particles in them, so the saliva is not clean, and then they drool all over, and then they get rashes. So if you clean your baby's mouth all over, well, you won't get this rash. Okay, now comes the myth and the conspiracy of teething and fever. So there are a lot of episodes of fever when they say, sometimes when I ask my kids' parents and say, oh, has the teeth came out? And then they say, oh no, I don't think so because there is no fever. Okay, so a lot of us thinks that teething and fever come hand in hand, that your child has to have fever when they are teething. So actually, fever is a symptom of infection. It's not a symptom of teething. Your child might have just a slight increase of temperature, very mild, probably at 37.5.6, that's all. Okay, it's not a full-blown fever. There are main reasons why the child is having fever at the age of 6 months to 9 months. Number 1 is during their developmental milestone at the age of 6 months to 9 months, they tend to grab on a lot of things and start putting it in their mouth. They're exploring their environment. Okay, they're grabbing things, then they are putting all sorts of things that they shouldn't put in their mouth. So that might cause some bacterial infection, okay, and that might be the cause of fever. So the second main reason why we see fever episodes during teething months is because when a child is born, they do not have their own antibody. That means their immune system are not developed. So they, because when a child takes in the mother's milk has the mother's antibody. And this mother's antibody only lasts for 6 months. After 6 months, the baby's body will destroy the mother's antibody. So there is this mismatch of months, the 6 months to 9 month period where the baby tend to be exposed to a lot of infection and that they might have fever or diarrhea, which parents might think that it's because of teething, where in actual fact it's not. Okay, so if your child is having a fever and you think that it's teething symptoms, it's actually not. So I would like to remind the parents and grandparents to bring your child to the doctor if they're having fever, because teething does not cause fever. Okay, just like to disclaim the myth here. All right, next. So how to relieve the teething symptoms, okay, when they are irritated, when their gums are red and swollen. So any swollen tissue will soothe with the cold, okay, that means icy cold pack. Anything that is cold will soothe the baby. So you can see here, you can use a clean gauze or a hanky, which is clean, okay, soak it in ice water, cold water, just rub it around the gums, they will be soothed, okay. Don't really have to buy over the counter gel to apply, not very necessary. So any chilled gauze or cold fruits, okay, like watermelon, you can see blueberries, put it in the fridge. As long as it's chilled, okay, it will soothe the gums of the teething symptoms. Next, we can see widely available teething biscuits, okay, that you let your child munch on, or even teething toys. You can put your teething toys in the fridge also, chill it, okay, and then give it to your child. They will love it. So these are some of the ways to relieve teething symptoms. Now I'd like to share with you something called anomalies. So anomalies are something which is special, which is out of the normal things that we usually see. For example, we have a child where I mentioned that the teeth comes out around 6 to 9 months. So an anomaly is where a child's teeth doesn't come at this period. It might come at birth. That means the child is born with teeth itself. Okay, so it is not uncommon. So we call this the neonatal teeth. That means when the OB-GYN deliver your baby, and then they will check, okay, 2 eyes, 1 nose, 1 mouth. Oh, got extra teeth. So they will call the dentist in. Okay, so it's not that normal. It is quite normal. I've seen many cases and have treated and attended to many cases of these. So these are teeth that present at birth or within the first month of life. Okay, 1 to 10% are extra teeth. That means it's extra from the original 20 teeth of that set that you have. But 90% of it is prematurely erupted. That means they belong to that 20 teeth. But the problem is the roots are not fully developed. That's why it's a little bit shaky, okay? And it interferes with breastfeeding, okay? So it is difficult for the mother to feed the child if the child is born with teeth. They tend to bite on the mother's nipple when the mother is breastfeeding. So normally the decision to extract it or not right after birth, we will discuss with the mother and see if she's breastfeeding well. If she says that no, the baby is biting, then we will remove it. Okay, and if it's mobile, I will also remove it because we don't want any risk of it falling out and the baby swallowing it. It might go into the lung. Okay, so these are the two. If it's mobile, I will extract it, and if it interferes with feeding, we will also extract it. But by the time of 6 months, then you will be 2 front teeth less, but which it doesn't really bring any long-term side effects, so it doesn't really matter. Okay, so these are some of the anomalies that I would like to, interesting things that I want to share with you that I see. This is a personal case that I have met last year. So this baby was born with like a balloonish cyst in his mouth. Okay, so actually it's a fluid buildup in a follicle. A follicle is like each of our tooth is like wrapped in like in a bubble. Okay, so when this bubble is filled with fluid, it balloons up. So this is the case. So before, right after birth, we remove some fluid, send it to the lab. no malignancy, no cancer. So we just left it and then it will resolve on its own. Okay. So some of the things that we see is this is another cyst. This is a bigger boy. He's around 4 years old when he came in with a cyst here. So this is a cyst of minor salivary gland. That means the glands which produce saliva. Okay, it just balloons up. So what we do is we just laser it. Okay, suture it up, heals. The procedure takes around 10 minutes. No big problem. Okay, so all of these are very similar. So there's one thing that we see very common is that some babies are born with a tongue tie. Okay, this is quite common. You have heard it before, a tongue tie. So tongue tie is a short and a thick frenum, a tissue that is tying the tongue to the floor of the mouth. So we can see when the baby cries, the tongue is unable to lift to the palate. So this will bring difficulty to breastfeeding, okay? And if this continues to older ages, when the baby starts learning how to speak at age 2 to 3, they will have speech difficulties like the T, the D, the T, the Z, H, the the R, the L will be difficult because of a tongue tie. So what do we normally do is we can see as young parents, you can see and check on your own if the tongue has a love shape or a V shape when they cry. Okay, the tongue is not able to lift up. There is a risk that your child is born with a tongue tie. So what do we normally do is we just use a laser to laser the tissue off, okay? And then it heals without scarring. So the tissues in the mouth heals very well without scarring. That is like a miracle. Almost all other tissue, the skin and everything, when it heals, it's very fibrous. It will leave a scar, okay? No matter how nice it is, there is a small mark. But magically, in the mouth, whatever we do, there is hardly any scar tissue. So any procedures that we do on young kids is actually very safe and it heals very beautifully, okay? So next we will go into our main topic about dental caries. So dental caries is cavities, okay? That means in Chinese we call 蛀牙, okay? So then we say gigi sudah berlubang, okay? So in order to know how to prevent dental caries, we need to know how does caries form, okay? Only when you know how the formation of dental caries, then you know how to tackle this problem. So in this picture, you can see this boy's mouth, right? There are blackish stains on the teeth. These are the ones. Oh, you can make out, oh, 你有蛀牙. It's like, oh, there are little holes in your teeth. All right. Some might find it fascinating, but this problem actually causes a lot of pain to some of the kids until the point where they find it difficult to eat. They find it difficult to sleep. It affects their sleep. This is a table of taken from a government website. So this statistic shows the prevalence of dental caries. It is not really up to date, but it's around there. So we can see up to 5, the preschool age, up to 5 years old, around 70 to 80% of the kids has at least one teeth that has caries. Okay, and then the 12-year-olds, we can see they are quite better because up to 12-year-old, you have just went into your second set of teeth, you know, the first few years of second set of teeth, takkan so fast spoil, right? So it is slightly better. 30 to 40% of them has dental caries. And the adults, the ones above 15 years old, at 2010, 88.9% of the people has some form of dental caries. So 8 out of 10 of people has some form of dental caries in their mouth. So what is the problem and how does these caries come about? In this picture, I think even kids will understand. So what I normally say is the bacteria in your mouth will eat the food that you eat. And the byproduct is an acid. Okay, so whatever you eat, let's say if you eat French fries, you are also feeding French fries to the bacteria in your mouth. Okay, So the byproduct of this will be acid. And the teeth, which is staying in your mouth, is affected by this acid. And then there comes your cavity, there comes your juya, okay, the blackish holes on your teeth, right? So this is a very simple equation. Again, so your tooth, and there is bacteria, and there is food. Okay, over time, you will get decay. So in this simple equation, what we want to do is we want to reduce your dental decay, right? So in order to reduce the dental decay, you have to increase the quality of your tooth structure, right? Tooth structure has to be strong, okay, to withstand all the acid attack from the byproduct of the bacteria. We want to reduce the bacterial load in your mouth, and we want to reduce the sugar intake, okay? And if you increase the quality of your teeth, reduce the bacteria and reduce the sugar, you will get less chance of getting decay, right? Okay, so keep this in mind, and then when we go on with this talk, you will know what am I talking about. All right, so the first point is we want to increase the quality of the teeth. However, some people are born with teeth which are lesser in quality. That means the structure of the teeth is a little bit weaker. They are born with weaker teeth. Okay, the structure, that means it's not as strong as an original one, where a normal teeth. Okay, other than that, we also get susceptible tooth surface. That means the surface of the tooth is such that it will catch food. For example, this is a very deep fissure, we call it. So what I normally say is our teeth has hills and valleys, okay? So the hills are the ones that help you to bite, and the valleys are the one that traps food and bacteria, okay? And all these valleys are very deep in young kids. When the teeth newly erupts in the oral cavity, the valleys are very deep, so it traps food. Even the bristles, even your toothbrush cannot clean this area. So naturally, right, these areas will have caries eventually. So you can see the blackish areas, the valleys of the teeth will get caries first, right? So how do we prevent this? Okay, because since I'm born with deep fissures, so how can I prevent this? So what we normally do, we can see on the left, we can see very deep fissures here, right? So what we normally do is we seal these valleys off. Okay, we call it a sealant. So basically, it's just a normal dental filling lah. Without drilling the teeth, we seal it. That means we prevent the caries from forming at these areas itself. So I normally do this when the kid is around 7 to 8 years old, when their adult molar just comes up. If their parents bring them in, I'll say, your child has deep fissures, let's seal them up, okay, so they won't get that. Okay, so there's one of the treatment that we can do to prevent dental caries in these kind of dental caries. We prevent them from forming at a very young age. We seal the fissures up, right? Unfortunately, some of the kids will be born with teeth that has holes in them already, but they are yellowish, they are like pits, you know. That means the enamel are very susceptible to acid attack. Okay, so unfortunately, some of the kids are born with teeth that are not so strong. So in these cases, we really have to monitor them since young. If not, the teeth will break down within 1 to 2 years. It will start having holes like this. It will start pitting, we call it. However, there is a natural protector, which is the saliva. Okay, the saliva actually plays a very important role in our dental health. So saliva acts as a buffer. Okay, so just now we remember there was acid, build up a lot of acid from all the food. So how do we get rid of all this acid, right? The saliva is actually quite alkaline, you know. It will neutralize the acid. It will push up the pH. Okay, it has antibacterial functions. It has functions of digestion with enzymes of lipase. Enzymes for lipids. Okay, amylase enzymes for starch. okay? And it acts as a lubricant also. Okay, your saliva helps you to speak, helps you to swallow, helps you to chew. So saliva quality is very important. A fun fact, we actually produce up to 1.5 liters of saliva per day. That is a lot. That is one full bottle of saliva. Each of us will produce 1.5 liters of saliva every day. So we have a lot of natural protector, okay? Despite all the food that we take in and all the acid produced, this saliva is very important. However, when we sleep, the saliva production is very low. That's why when you wake up, right, you actually feel what, your mouth very dry. You either need to go and rinse or brush or drink a cup of water when you wake up, because when you sleep, your saliva production has dropped more than half. Okay, so as we can see, this is a constant battle that is happening in our mouth. Okay, the reddish part, the negative, is the demineralization, okay, from the acid, from all the byproduct of the bacteria. So the acid will remove the calcium and phosphate from our teeth, but the saliva is constant helping you to add in calcium and phosphate into your teeth. Okay, so the saliva actually acts as a natural protector from dental caries. Okay, so depending if the demineralization wins, then you have dental caries. However, if there is more remineralization, that means there are more minerals going into your teeth, then your teeth is pretty much protected. Now I want to explain to you something called Stephen's curve. Okay, when you understand Stephen's curve, you will know how to eat sweets and not get dental caries. It's actually quite magical. Okay, if you see this curve, right, it's drawn after a sucrose rinse. That means after a very sugary drink, for example, bubble tea. Okay, right after you drink a very sugary drink, right after a cup of sweet Ribena or a sweet juice or sweet bubble tea, the pH in your mouth drops from 6.5 to 5, okay? And this line we see here is a pH of 5.5. We call it the critical pH. That means if your mouth has a pH of less than 5.5, calcium starts to come out of your teeth, okay? That means calcium is coming out of your teeth. You're starting to have demineralization. And because of the role of saliva is trying to push up the pH for you, okay? And this takes around 10 minutes. Okay, so if we put it in our daily life, how does it help? So imagine if you were to take 5 meals a day, breakfast, lunch, dinner, and snacks in between. Okay, every time you eat, the acid drops down to less than 5.5. So the calcium comes out of your teeth. Okay, so if you eat 3 meals a day, it only happens 3 times a day. This calcium which coming out of your teeth only happens 3 times a day. But as kids, right, we know that they get hungry all the time, right? You want to eat biscuit, you want to eat chocolate, you want to snack on this and that. They just want to keep eating, you know. So end up they snack many times in between meals. That is the problem. If you snack many times and you have many small little meals, and if your little meals are like very sweet, like caramel, all the sticky food, all the biscuits are very sweet with chocolate, right? Then you get a lot of calcium coming out of your teeth in one day. Okay, so if you understand this, you will know how to snack wisely. I'm not saying that you cannot eat many little meals. Of course, kids get hungry, or even as adults, you want to take in between meals. But choose your snacks wisely. When you snack, you don't snack sugary snacks. All right, you snack those food which won't reduce the pH so much in your mouth. Okay, if you want to snack, if you want to eat chocolate, you eat it during meal time. That means after rice, right? After you take your main meal, you straight away go for ice cream or chocolate, you know? All the sugary things, you push it to the main meal because you're not gonna miss your main meal, right? So if you want to snack, you snack wisely, you snack on those food which don't cause dental caries. Okay, for example, fresh fruits, nuts, unsalted nuts, grains, okay, wholemeal grains and biscuits. All these things good snacks. Cheese is a very good snack. It's actually cheese has properties which protects your teeth. Good news to the kids that love cheese. All right. So yogurt is also very good, but of course all these has to be unsweetened. Okay, choose your snacks very wisely. Next, keep your sweet snacks to mealtime. Okay, I'm not saying you cannot eat sweets. Okay, it just doesn't make sense. Of course, doctors say 不要吃甜, 不要吃甜, right? But it just doesn't make sense. So it's widely available. You're taking away like joy as a kid growing up, right? But you have to take it during mealtime, all right? And avoid those very sticky ones, okay? Especially those that which sticks on your teeth, those where you are not able to brush it out properly. Some of the dried fruits and the caramelized chocolate, all these are very sticky. They tend to stick at areas where you cannot brush. So those are the ones that you want to avoid, the very sticky ones, all right? And then you have to rinse after every time you take a sweet meal. All right, rinse after every meal. I tell my kids, even when you're at school, after you eat in canteen, go to the sink and rinse. Okay, if you rinse, there are no more food on your tooth surface, so you won't get cavities. These are very simple tips, okay, that everyone can practice even as adults. This will reduce the risk of caries a lot. All right. So I hope everyone is still with me. Now we're going to see the different layers of teeth. When you understand this, then you know, then we can see dental caries better. So as we know, that our teeth is mainly made up of 3 layers. The outer layer called the enamel, second layer called the dentine, and the third layer is the pulp. Okay, fun fact, the enamel is stronger than your bone. Okay, the enamel is actually the strongest thing that your body produces, all right, which is the outer layer of your teeth. It's 96% mineral, is stronger than your bone. The dentine second layer is 65% mineral, so it's not as hard as the outer layer, right? And the pulp is the inner layer, the red color one, right? So this is the blood supply of the teeth, okay? The blood and the nerve, all this area, right? So imagine if your caries is in the enamel, your enamel is still very strong, okay? So if I see, oh, there's a small hole in the enamel, it won't cause pain, okay? If your caries has gone into the dentine, then you might have some pain and sensitive because it's much nearer to your pulp, all right? So that makes sense. So in this picture, you can see if the caries is still small, it comes from the outside, right? Caries always from the outside. So this caries, the first picture is only in the enamel, okay? We want to fill the caries which is still in the enamel, because when we do a filling, when you come in and the hole is small, it doesn't cause pain at all because there is no nerve endings there, okay? It won't cause sensitivity. However, if your caries has gone into the dentine, then you say, wow, this doctor do feeling very painful. Actually, it's not the doctor's fault, you know. You see, your caries has gone in so deep, it's impossible to not feel pain. It has almost reached your nerve, right? So if your caries has gone into the pulp, right, unfortunately, it will be very painful. So this is the episode where your child will feel painful when they eat, okay, when they drink cold water, all right, especially when they eat hard food, nuts, or mommy 很痛, very painful. Or some of these might have abscess. That means abscess is actually it's like a breakdown of tissue and then from byproduct of bacteria. So in layman, we call this a nana lah. So a tooth will also have nana. Okay, so if your tooth has nana, right, it'll be very painful if your abscess is not drained. Right? If the components of the abscess is so tight, then you feel a lot of pressure here. Then you will have dental pain. Okay, so we don't want to see a kid or any adult. We don't want them to come in at the last stage. We want to catch caries when it's small, and we want to fix the problem when it's small. If the kid comes in at this stage, right, of course they will feel pain. They are already very irritated. It's very difficult for dentists to help at this stage. Okay, so some of the differences between permanent and primary teeth. So the baby teeth is much smaller, so it makes sense that all the layers are much thinner. So the rate of dental caries going all the way into your pulp is much faster in a kid. For example, the time taken for a caries to reach the pulp in a kid might only take 2 to 3 months, okay? If I don't see my kid for 6 months or so, they might come in with a new caries and it might already cause pain in comparison to an adult, okay? Because the layers of the adult teeth are much thicker, okay? So it doesn't progress as fast as how it progresses in a young child, okay? That is why a lot of kids get dental caries and then it's very painful for them. So this is we call it the chronology of dental caries, like how it progresses. So a very early lesion you can see in the first picture is just very innocent whitish spots. Actually, most of the people doesn't know that this is the first stage of caries. White spots on your teeth. Your enamel shouldn't have white spots. Any white spots are very early caries lesions, especially in kids. Next, you will see, oh yes, the enamel has broken down. The second layer is more yellowish. The dentin is more yellowish. So the second stage is enamel breakdown. We can see there is already a hole. Okay, and then this one definitely as adults, we can make out, okay, your teeth has already gone dark brown, okay, the color has changed, the structure has broken, right? And then the last one we can see, most of the teeth is affected, okay. So inside the mouth, we can see, oh, there's a black spot here, there are multiple black spots here, okay, and then in some cases, then we will see dental abscess. So abscess again is called the nanala, right? So there's a swelling, right? There might be pus in it, there might be blood in it. These ones are quite painful, okay? So if you, as parents, you were to check if your kid has screaming for pain or tell you that they have some pain, you can actually lift their lips to check if there's any swelling or any change in color. It will be more darkish red in color rather than the normal pink, okay? It's more purplish if it's filled with blood, okay? So these are the ones which are painful that we want to avoid. Unfortunately, the dental infection tend to spread very fast in kids, okay? So in some kids, the dental infection spreads all the way to the lower eyelid, okay, the infraorbital space, okay. This poor girl has a spread infection also, again, very reddish, the cheek has swollen, gone out of shape. This young girl has a very big abscess, all right, from the tooth to the lower chin, the lower jaw, and the back of the jaw below of the ear. So some infection spreads very fast to the spaces of the face, okay? And then it affects many things. As for example, in this kid, when the abscess spreads all the way to the lower jaw, right? The pressure is so big, it pushes the tongue up. So you can see that this child actually cannot close his mouth because the floor of the mouth is pushed up, that she has to open her mouth to breathe, to draw air, okay? So this one needs hospitalization. We need to drain the abscess from outside and all those things. So what started as very innocent looking white spots might just escalate one day into a facial infection, which we don't want it to happen in our young kids. Some of the common causes of dental caries we can see. Of course, the second one we see is a very high in sweet and sticky food, which I had already mentioned. Inadequate brushing, okay, inadequate oral hygiene is also a factor. Kids don't like to brush, okay, they just want to go to sleep after they eat. It's so tedious, you know, just go to the toilet to brush their teeth. It hasn't become a habit to them because they are at their early age of life. Okay, one of the things that I want to explain is at will milk feeding or at will breastfeeding. These are feeding of milk. After the teeth has erupted, we know that babies tend to wake up at night and ask for milk, right? If your baby wakes up at night after their teeth has erupted, for example, past 1 year old, your baby is still waking up to ask for milk. And if you're only feeding one time, it's actually quite okay. But make sure to clean after you feed at night, because at night, as I've mentioned, the saliva is so low that there is no protection to the teeth. Whatever milk that you give stays and sticks on the teeth will straight away cause caries. Okay, and when it sticks on the teeth, it sticks on all the surfaces. So it's not that only one teeth goes bad. The whole entire oral cavity is full of dental caries. Okay, so some kids wake up at night for mother's breast milk multiple times, for example, 3 times, 4 times, 5 times, past age 1 or 1.5 or 2. So normally in cases like this, they come in with widespread caries on their teeth. One of the main causes is that I tell parents, if you want to feed so many times at night, you have to clean so many times at night. That means if you were to feed 5 times, you have to go and clean their mouth 5 times. So you have to find ways to put your baby to sleep even if they wake up at night for food too often. I'm saying if it's too often and it has passed the age of 1. Okay, I know different babies are different, but this is one of the main reasons where we get caries all over. Okay, and then sometimes some tips that we give is try to dilute down the milk that you give at night. Try to tell your baby that, okay, at night is a time for sleeping, pet them to bed. Try to give them warm water instead of milk and see if they still cries. Okay, if they still cries, okay, just feed them, but you have to be very, very diligent in cleaning if you're feeding multiple times at night and if they already have teeth grown in. Okay, so the common symptoms that we have if your child is affected with dental caries, some pain or sensitive when they're eating, pain at night, okay, swollen gums, okay, fever. Those are signs of infection already. Some of the treatment options that we can look into if you have dental caries, depending on the severity of dental caries. So if it's only the mild white spots, right, we don't actually have to do a filling. We can do a fluoride application. So this word fluoride is quite common and you might have heard of it before. Fluoride is actually an active ion, F negative. Yeah, it's an active ion which protects our teeth. It makes our teeth stronger. Okay, that's why we have fluoride in our toothpaste. In all adult toothpaste, almost all adult toothpaste, there is fluoride. And in Malaysian water, our drinking water is fluoridated. Okay, at the year of 1950 something. For 1950s, we have fluoridated our water at a level of 0.6 ppm parts per million. Okay, so the water you drink has fluoride in it, which protects your teeth. Okay, fluoride is also naturally presented in most teas, leafy vegetables. Okay, so we always take in fluoride. So in cases where kids which have high risk of dental caries, we can apply fluoride twice a year. Normally we do it either twice a year, or if the caries rate is really high, sometimes we'll apply every 4 months. That means 3 times a year. Okay, so some dentists will apply fluoride for your kids, just a protection. Okay, if the caries is already gone deep, unfortunately we have to do a filling. Okay, either a filling or a sealant, which I've explained previously. Without drilling, if there is no caries, if the fissures are deep, you can just do a sealant. Okay, however, if the caries has gone all the way into the pulp, okay, we can do a treatment called pulpectomy. This is a very new term for most of you, but if you have heard, in adult teeth, we call this the root canal treatment, right? If I say root canal, then probably you have heard of it, a root canal treatment. So a pulpectomy is actually a root canal treatment in the kid, okay? Then you say, wow, doctor, you're very ambitious. In kids also you can do root canal. Yes, okay, it is not impossible. I do it almost all the time, okay? My youngest kid, which I have worked on for pulpectomy, is 3 years old. Okay, my 3-year-old kid can take a very small injection, open its mouth for around 20 to 30 minutes for me to work, and it is very successful. Okay, it clears the pain. We just need to prepare the kid. We just need to go slow with the kid, and then after that we will put a I call this the Iron Man crown, you know. I tell my kid, okay, I'll put Iron Man crown now. It's the stainless steel. Oh, you have an Iron Man crown on your teeth. Okay, it's for them to protect their teeth from breaking after a root canal treatment if they need. All of these efforts only to prevent the episode of an extraction. Okay, we don't want to put our kids into extraction at a young age because it's very traumatic because the roots are still so long. We need to, you know, put so much force and pressure onto the kid. It's very traumatic for them to go through a dental extraction when the tooth is not yet shaky. And secondly, it causes loss of space. Each of our baby teeth actually acts as a guide, you know, as a pathway for our adult teeth to grow in at the correct position. So in this picture, you can see this length is much more, and then on the right, the length has reduced. Okay, on the left is a picture of 2 stainless steel crowns. That means we didn't extract the baby molars. And on the right, you can see that there are baby molars which are extracted. Okay, and we can see that the length has reduced. That means the teeth at the back has moved forward. We call this a loss of space. So if we extract the baby teeth too early, we get loss of space. And this is what we will result in. We will result in overcrowding. As you can see here in this picture, there are many overlapping tooth. Okay, because this molar has gone forward so much. Okay, so you can see in this picture, this molar comes out at the age of 6. All right, and this premolar comes out at the age around 10 to 12 years old. Okay, so if you extract a baby molar too early, the adult molar will fall in. Okay, there's nothing to stop the teeth from moving forward. All our teeth tend to move forward, they won't move backward, right? So if we do an extraction at a very young age, all the teeth has no guide, they don't know where to move, they will move everywhere, and then you will end up with a lot of crowding, and then a lot of problems here. It's not able to clean this area, a lot of food trapped here, and then you get cavities all around. Yeah, it's a total disaster. So all in all, we want to prevent an episode of extraction at a very young age. However, if there is no choice and we have to extract the tooth, we still have a device where we can, an appliance where we can fix in the mouth to maintain the space. Okay, this is called a space maintainer. Okay, all we need to do is take an impression. Okay, now more take impression, and then we will fabricate this small little wire to maintain the space. All right, until the adult teeth is ready to come out. So when the adult teeth is ready to come out, we just remove this space maintainer. Very simple. All of the kids can eat in this. There's no pain, there's no discomfort. They get used to appliances in their mouth very soon. All right, so now I want to go into how to brush and what are the oral hygiene measures. Okay, so before teeth eruption, all right, so even before your baby teeth come out, right, you have to clean the tongue and the gums and everything already. So use wipe the gums and the tongue with a wet gauze. Okay, it has to be done every time after feeding. I've mentioned every time after feeding, even at night, even when you're very sleepy, even if you have to go to sleep. Yes, you have to clean your child's teeth every single time after they eat. Okay, especially when you're babies. Okay, next, after teeth eruption. Okay, so that means after 6 months to 1 year old, you have to brush your kids' teeth twice a day, once in the morning, once at night. All right, introduce a toothbrush once they have their teeth erupted. Okay, make this a habit to them since young. Okay, make this a habit. Introduce a small little brush, okay, or a gauze. It's very easy to find now. Okay, just do online shopping on Shopee or Lazada. Okay, see, this is a toothbrush where you can slip in the parent's finger. Very easy, just to sit in and just quickly brush it. Okay, twice a day. So we only introduce fluoride toothpaste when they learn how to spit. Okay, because we don't want them to swallow in the fluoride. excessively. Okay, so only when your child knows how to spit out their toothpaste, then you can buy a fluoridated toothpaste. Next, if you have gone to the dentist very often, some of you might have known there are some additional products where you can use to for those kids who have a very high caries risk. So number one is a tooth mousse. This has like a cheese type of protein. Okay, so after brushing, dry the teeth, apply it all over. It's actually available in most of the pharmacies. You can find it. The brand is GC. Okay, GC. It's called a tooth mousse. It comes in many flavors. Okay, even adults can use this. This is just to protect their teeth. Next, mouth rinse for kids, which has fluoride. Or you can use adjuncts like a handle floss. The parents can actually help them floss the molars behind. Okay, this is a slightly newer device. We call this a water flosser. So instead of the traditional floss that we use, we can use actually this device. Okay, it actually pumps water. Okay, so it's like a water jet, you know, you just put the tip near your teeth and then it pumps water. It helps to clean all the in-betweens of your teeth. It's actually a very good tool for adults actually. So unless your kid is like past 7 to 8 years old and then they can handle a water flosser, then why not? But this is a very good tool for adults also, a water flosser. It's like just like a water jet. Next, we come to see how much toothpaste should you use for your kid. If your child is younger than 3 years old, use very minimal, just like a smear, okay? Just like a grain of rice, a smear. If your child is 3 to 6 years old, use a pea size, okay? Like a green pea, not too much. Every time we see any commercials online, right? We see, wow, very generously, a lot of toothpaste, okay? This is actually no use on, okay? Too much toothpaste. It causes excessive foam, too much foam, right? And then if you brush with too much foam, the foam is just everywhere. You just want to spit out, okay? So the toothbrush plays a more important role than the toothpaste. So do not use too much toothpaste. And then encourage your child to rinse out or spit out the toothpaste. Some of the countries encourages the no spit, that means the no rinse technique. That means they do not encourage people to rinse. That means after brushing, just keep the paste in your mouth. I personally do not practice this, but I do not go against this philosophy. But as for kids, try not to, because probably we do not want them to swallow too much fluoride toothpaste. We want them to spit out and just gently rinse. Next, we come to a comparison. Okay, so we say, oh, is electric toothbrush better than the manual one? Okay, we are flooded with a lot of options nowadays. Okay, so let me just do a simple comparison for you. If you're using a manual toothbrush, okay, if you wake up very groggy in the morning, you might just miss some areas, don't want to brush this area, or brush 10 seconds, finish already. Okay, and then on the other hand, if you're using an electric toothbrush, right, it actually rotates for you. Okay, so this is like lazy people's toothbrush lah. You just put at the area, it just does the job for you. The good thing about electric toothbrush is you will not miss more areas, because as kids, right, when you ask them to brush this surface, and then their dexterity is not so good, so they're not as dexterous as adults. Their motion is not so good, so they tend to miss on the back teeth. So in kids where if I see they are not brushing well, I might ask the parent to maybe try an electrical toothbrush. But if you're still using a manual toothbrush, there's no problem. Okay, I'm personally still using a manual toothbrush, so as long as you can reach all the areas, manual toothbrush is fine. All right, but there are more human factors to a manual toothbrush. Some adults brush too hard. Okay, however, in an electrical toothbrush, there are already modes set in it. Okay, you can choose power 1, power 2. Okay, you don't have to press too hard. You just put it gently on the surface and it will do the job for you. So it takes out the human factor in brushing. However, it's of course more expensive to replace an electric toothbrush, and we are supposed to replace our toothbrush every 3 to 6 months. Okay, some of the patients come with toothbrushes which are the nylon bristles are already open, like kai hua liao, you know. So that will hurt your gums actually. So do replace your toothbrush every 3 to 6 months. This is a brand which I will not mention. They sell this electric toothbrush, and this is what they promote. Okay, they have rotation and oscillation rather than just brushing up and down. The rotation of the head helps to clean the teeth, right? And then there's a timer for you. You can set like a 2-minute timer, where's the recommended time to brush your teeth, okay? 2 minutes. And then there are modes, okay? And then there are like pressure sensors. That means, oh, it will beep when you're pressing too hard or you're brushing too hard, okay? So yeah, of course, doesn't apply for everyone, but it is definitely an option if your kid is not brushing well or is brushing with the wrong method. Okay, we can either bring it to the dentist to ask the dentist to teach a proper brushing technique, either that, or you can try buying an electrical toothbrush. Next, we'll come and I'll show you a video of how to brush the child's teeth. All right, so
to begin brushing, place the toothbrush at a 45-degree angle to his gums and gently move the brush back and forth in short, tooth-wide strokes. Brush the outer surfaces, the inner surfaces, and the chewing surfaces of the teeth. To clean the inside surfaces of the front teeth, tilt the brush vertically and make several up and down strokes.
All right, so it's a very simple video on toothbrushing. Basically, you just have to angle your brush 45 degrees to your teeth and then brush every single surface of your teeth, including your tongue. Okay, so how to make brushing fun for kids? Okay, you can bring them to the mall or do online shopping and then buy a very cute toothbrush for them, you know, their favorite cartoon character, to encourage them, you know, to colorful one, like their favorite Marvel superhero. Okay, all these little things will encourage them, you know, bring some excitement to the ever boring toothbrushes that adults use. Okay, choose an interesting cartoon character. Next, you have to tell them that it helps fight the bad guys, you know, okay, the dirty plaque and the bad food, we have to remove them. Next, we can set a timer for 2 minutes to encourage them, okay, play a favorite song or video. Then the simple one, the common ones are you give them a reward chart, okay, so we want to help our kids to cultivate the habit of brushing twice a day. Okay, so there's a reward chart. For example, this chart says I'll give them a sticker to stick if I brush every day for 1 week. Okay, if I have like a clean streak of 7 days that I remember by myself to brush my teeth. Okay, and then give them a reward after the end of the week. This will greatly help your child. And then the children of the 21st century is actually very fortunate to have all these applications on their App Store and the Google Play Store. I would like to show some of the apps and some of the games where you can actually encourage your kid and to brush. The first one is by Oral-B. Okay, I'm not a fan of Oral-B. I'm not advertising for them, but however, they have a marvelous app. If you were to download from your phone, this app called Disney Magic Timer by Oral-B, it actually syncs and pairs to your Oral-B toothbrush, electric toothbrush, if you have one. Okay, it syncs and pairs. It is so customized. You can choose a profile. You can choose Winnie the Pooh, you know, any Marvel character. Name your toothbrush, right? And then set a timer to brush, you know. Yeah, it's so fun to do all these things. It really encourages your child to cultivate the habit. All right, so kids learn and they will earn like stickers in this app. They have games to play, and then every time they finish the 2-minute brushing, they will earn a sticker, right? So the next one will be this game called Tooth Savers. Okay, so basically it can be played on an iPad or a tablet or something. So if your child don't want to brush, oh, just download this app. Really, it helps to show, oh, you see that all these monsters have bad teeth, you know, and then to win the game, you're supposed to help to brush their teeth for 2 minutes. You're supposed to like swipe all the dirty things from the teeth. So it's actually quite easy to make brushing fun if you were to have like devices and to download all these apps. Next is app called Brushies. Okay, the Little Monsters toothbrush timer. Again, there are like cartoon characters. You can play the game with them. You can customize and choose friends. All right, and then there's a timer to go for 2 minutes and make your kid brush. The final one is another app called Brush Up. Okay, this app is quite interesting. You have to allow the camera on your device. It actually mirrors the child while brushing, and then this little robot, right, the robot will actually go every single teeth, and then the kid can look at the device and brush. So it's like a mini dentist at home, and when the robot is brushing this area, okay, and then the kid can look at themselves, it will mirror themselves following the robot to brush. So all these apps, like as parents, you can download them, all right? It can make brushing very fun. It helps cultivate the habit of brushing since young. Okay, it will save a lot of pain, save a lot of money down the road. All right, almost coming to an end now. I would like to touch a little bit on malocclusion. So malocclusion is like the incorrect position of teeth. So nowadays braces, right, is very popular among kids or young adults or even adults. So the common question is, do my kid need braces? When should my kid start braces? Right? So if you've listened to this, you will get the answer. So a meta-analysis in the year 2020 of the incidence of malocclusion. Worldwide, 56% of the people has some form of crooked teeth. In Malaysia, 80% of Malaysian population had once crooked teeth problem. Okay, so it comes in many forms. It either has crowding, that means not enough space, or excessive space, that means too much gap in between teeth, or something called a cross bite, that means some bites are in, some bites are out. This one you can see is an open bite, that means the front teeth are not meeting. We call it an open bite, right? Some is too much protrusion, like very baggy like that, 很凸你的牙齿. Or some we can see is the canine coming out at the wrong position. So these are some of the things that we see in when the adult teeth come in, that as parents you can see. However, malocclusion also not only affects the teeth, it also affects the jaw. Okay, so some people will have how do you see if your jaw is affected? Okay, we have two jaws, right? Upper and the lower jaw. Only the lower jaw is movable. The upper jaw is not movable. The upper jaw is fixed to the face and the scalp. However, the lower jaw is movable. So when you speak and you eat and you drink, right, only the lower jaw moves. So when you look to the side, right, as you can see the profile, a nice profile is like a balanced face from the nose to the upper lip, lower lip to the chin. If this balance is off in the first picture, you can see that the upper jaw is too forward, right? So it's a form of malocclusion. Some kids will have the lower jaw too forward. The lower jaw is like protruding, okay? So it's a very, very, we call this a class 3 jaw, all right? So in these cases, with different cases, we want to fix at different timing. Why? Okay? Because the upper jaw and the lower jaw grows at a different age. The upper jaw grows around 8 to 10 years old, depending if you're a boy or a girl. A girl matures much earlier, so we would normally want to treat girls around 1 year earlier than boys. The lower jaw, however, grows a little bit later, around 9 to 11. In boys, it grows up to 13 years old. So different problems of the teeth and face we want to treat at different ages. Some malocclusion actually caused by habits, okay, since young. Some thumb sucking habits, some pacifier habits, okay. These habits, if brought up to an older age, 6 to 7, will cause bites which are open, we can see, okay. Some parents come in and say, Doctor, my child's teeth got a lot of spaces in them. If you have spaces in your baby teeth, It's actually a very, very good sign. I'm very happy to see my kids' patient if they have gaps in their teeth. On the right picture, you can see in comparison, there are no gaps in between their teeth. So it's like everything is nicely in place, right? There are no gaps. I can surely 101% tell you that in this child on the right-hand picture, if your child doesn't have any gaps in their teeth, they will not have space for their adult teeth. The adult teeth is so much more bigger than the young teeth. In a good jaw, in a young child, you are supposed to have spaces in your teeth, all right? Next, in children, we also see open bite, right? Where either from a thumb sucking or in cases where the baby's tongue is keep thrusting. We call this a tongue thrust. That means when they say S, right, the tongue pushes out, right? It's a habit. There are devices and appliances where we can make the child wear to correct this habit, and we have to do a lot of speech training also with this if you have a habit. On the other hand, we can see here, this is a reverse bite in a baby teeth, right? I've seen many cases of this where the young child actually, the teeth just grows in such way. That means the lower teeth is in front of the upper teeth, which is wrong. The correct one is on the left. The upper teeth should be in front. So if your child is born with the lower teeth in front, right, we have to correct it as soon as possible. As soon as your child is cooperative enough to wear a device, we want to correct it because the lower jaw is trapping the upper jaw from growing, okay? Year by year, when we are later and later into treatment, you will end up like this one day, okay? The lower jaw will keep growing forward. So as parents, I want you to check your children's teeth if they are presented in all of these, or the reverse ones, the open ones, okay? We want to treat them very early in life. This scenario is like a cross bite, all right? If you can see on the right, this tooth is in opposite position than the lower, okay? So this is what we call a cross bite. It's quite common when one of the teeth is in front and the beside one, the center teeth is behind, okay? So we want to correct this as soon as possible. If this grows into like a 17 to 20-year-old, then I'm sorry, we have to go for a full braces. So if your kid comes in at the age of 6 or 7, right? Recently, I've just treated a case. It only took me 3 weeks of wear time. I gave this appliance, okay? It only took me 3 weeks to kick the tooth forward. It is so simple. You just have to wear it. And the mother actually told me the wear time was only half an hour a day when the kid is doing homework. So if you come in at the correct timing when the teeth is still growing, I can correct the tooth very fast. If you come in at a full-blown malocclusion, I am very sorry, we might have to take 2 years. Okay, so timing is very important. So again, to the question, when is the best time to start braces? Unfortunately, one size does not fit all, okay? Some of you might say, oh, this dentist told me I need to wait until 14. Some dentists tell me 7 years old can start. Some dentists tell me 4 to 5 years old, if my child is cooperative, can start, right? I want to tell you that all of these answers are correct because they are correct for different cases. We treat every case differently. Different cases, we want to start at different timing. Why? Because if we start at the correct time, we can treat in the shortest time. We don't want the kid to be in braces for so long. It will actually wear them out. Okay, they are still young. It's difficult for them to wear a device for such a long period of time. We want to catch them during the best time, the growth. Okay, so what as parents that you should do is actually just to recognize and identify the problem. If you see, this doesn't look right, I think this teeth is supposed to be in this position, it doesn't look right, then bring your kid to the dentist and just have a consult or a checkup. If everything is fine, if the dentist say, maybe the space will close when the rest of the teeth erupt, we might want to wait, okay, then just trust your dentist and wait. If the dentist say, we have to start now, we have to correct this problem at this age, then trust your dentist and go with that treatment. All right, so I think I've gone way past. I think my time is up. So just a quote, you don't have to brush all your teeth, just the ones you want to keep. Okay, so that's all for my talk today. I'm glad that all of you who have still stayed in this talk and still now, thank you. I would like to pass the time back to Christine and see if there's any, we can go into Q&A sessions now. Christine, you need to unmute.
Yes.
All right.
I unmute my my physical mic, but I didn't unmute the the Zoom mic. Yes, thank
Okay.
you. Thank you, Eunice. Thank you, Dr. Eunice, for a very interesting and insightful talk. Now I understand why my eldest kid have some overcrowding in his teeth. So it's a very very knowledgeable talk for every one of us. If you have any question right now, anyone from the audience who like to ask question, please feel free to either unmute your mic or you can type in the chat box. So while waiting for questions to come in, I have 4 questions for Dr. Eunice to answer. So perhaps we can go with my questions first while waiting for the rest to ask.
Sure.
Eunice, can you see my
Wait,
question in the chat
where-
box?
Hold on. Let me go to the chat. All right. Okay. Yeah, I can see your questions. All right. Does the sealant affect the kids chewing? No. Okay. Sealant does not affect your kids chewing. Okay. So how? Okay. Let me just. Okay. What we do in sealant, right? We fill the fissures with a very, very, very thin layer of filling material. It will not affect the bite. Even in adults where your bite is very deep, right? You still can do sealant, even in adults. I myself do sealant for myself. Yeah, I myself will go for a sealant because sealant, right? You don't drill holes, so the sealant will wear off when you chew at it. Probably it will wear off in 2 to 3 years. So every 2 to 3 years, I will just go get myself a sealant on my molars. Yeah, it does not affect the biting. It's actually like you don't feel that it's there. It's just protecting the fissures. Yeah. Number 2, which age should a child use floss and mouthwash? Right. Actually, a child does not need to use mouthwash if they do not have caries. Okay, so the adjuncts that I mentioned, like the mouthwash, the floss, those are extra things. If your child is a high risk, that means they are prone for caries. Okay, then you can introduce all this. Okay, so flossing, I would say after 3 to 4 years old, when they are cooperative enough, the parents will have to do the flossing. Okay, the parents will have to help to floss using a handle floss, because the string floss will be quite difficult to handle in a kid which is moving around and then you cannot see, so it's quite difficult. Yeah, so it's not a must to use floss and mouthwash, only if you're recommended by a dentist, or if they have a lot of caries, then yes, we need extra measures to keep clean. Number 3, babies who are breastfed tend to have their teeth erupted earlier. Myth or fact? Okay, it might be true, because the breastfeeding motion, okay, where the gum pad massages and draw milk from the breast, actually helps to increase blood flow in the gum, so the teeth might erupt earlier. But it doesn't matter if the teeth erupt earlier or later, right? So to me, it doesn't really matter lah. But if you say that if you share it among mothers where some teeth erupt earlier, if I breastfeed my kid, probably 4 months, okay, then just let it erupt. If it's time to erupt, it erupts. Okay. Next, if we boil our drinking water from the tap, will the fluoride mineral be destroyed? No, fluoride will not be destroyed if your water is boiled. No. Yes, so even boiled water also will have enough fluoride and good fluoride to protect your teeth. Who to contact if you want to solve the teeth overcrowding? Okay, you can visit your personal dentist if you have one. Okay, and then bring your child to the dentist and say, oh, I noticed some crowding, and then you can ask the dentist, do you do braces? Because not all dentists do braces and not all dentists treat crowding. So the specialist who treats crowding is an orthodontist, we call it. So 绑牙专科啦. So if you want to bring your child to straight away to a certified orthodontist, then by all means, all right. If you want to bring them to just a general dentist but still practicing a little bit of orthodontics, also can, but choose them wisely lah, I would say. Yeah, because you don't want to mess up your kids' teeth, right? Yeah, so if you want, you can straight away bring them to a specialist. But in Malaysia, a lot of the general dentists also practice orthodontic works. So if you already have a dentist, then if they want to treat, they will treat. If not, you can ask for a referral. You always say, oh, 写信给我可以吗? Like to an orthodontist. Okay. Next. Is teeth whitening tool from Shopee works? Unfortunately, I cannot speak on behalf of this because I need to see the product itself. Okay, so let me touch a little bit on whitening. Whitening is only advised according to if you want to, there is no rule in Malaysia, but we adopt the British Dental Council. If you were to adopt the rules of the British Dental Council, whitening is only allowed if you are 16 and above. Okay, because whitening causes sensitivity. When you are young, your pulp is very big. So if you do whitening when you are young, at a young age, then your teeth is actually very sensitive. So we do not encourage if you are 16 and below. If you are adult, 16 and above, yes, if you want to do whitening. But the thing is, we want to see the active ingredients in whitening. The regulated whitening products is hydrogen carbide. Some products, which is around the maximum strength is 35%, and that is only legalized to be used and sold by dentists in Malaysia. Even the beauticians cannot use. So the take-home kit and those that you buy from online platforms and buy over the counter are actually very low in percentage, because that is the regulated amount that the government allows you to buy over the counter. Yeah, and with that very low amount of active ingredient, I'm not sure if you can see results that your teeth can be whitened. So that's what I can say. Any recommendation for orthodontists in Penang? It's very difficult to say. There are many orthodontists that I know, or even general dentists, which does not do, which are general dentists but do ortho. So I can speak on behalf of my hospital. In my hospital, Adventist, we have 3 orthodontists. Dr. Peter Loh, Dr. Ang, and Dr. Rajinder Pausing. So you can see either one of them now. Other than that, Prestige Dental, Dr. Che is a good orthodontist also. Yeah, there are quite a few lah. So even suddenly forgot this orthodontist name, opposite Adventist Hospital. Yeah, his own private clinic. But in my hospital itself, we have 3 in-house orthodontists. So normally we let them choose lah. And then different orthodontists also use different systems. So you can always go to a general dentist for consult. They can refer you. Next, how to remove black mark on kids' tooth. I need to see if the black mark is a stain or a caries. If the black mark is a stain, then normal cleaning, scaling or cleaning can remove all. But if the black mark is a caries, then we have to do a filling. That means we have to drill out the black parts of the teeth and then patch it back. Yeah, so far I have answered most of your questions. If you still have any questions, you can. I also invite questions if there's like questions on adult teeth. That's okay.
Yes, feel free to ask your questions. It's a very interesting Q&A just now. Eunice, have you heard about oil pulling using the virgin coconut oil? There was
Okay,
a
yeah.
lot of things going on the internet that people gave testimonies about reversing tooth decay using oil pulling. So, any thoughts on that?
Okay, so suddenly my chat. Okay, let me just on the chat. Okay, I want to clarify. For example, when your teeth erupt as a 100%, okay, and there is a cavity, for example, 20% already jadi cavity. There is no way to reverse this and become 100% again. Anything that the dentist do to fill up is still something that is not natural. Okay, so once the original structure has gone back, we cannot restore it again. Whatever we restore it with metal, with ceramic, with amalgam, silver filling, white color filling, anything else is something that we try to repair. It's like putting plaster on your teeth. So you cannot reverse something which is damaged because the body do not produce enamel anymore. Enamel, when it's born, is so much. If it's destroyed, you cannot grow back enamel. However, dentine, the pulp can, however, grow back a little bit of dentine, but that is another layer of dentine. We call it the reparative dentine, so it's a different structure. So for enamel wise, there is no way in growing enamel. So whatever ointment therapy that you say, or oil pulling, or ada gigi sakit, letak coconut oil, let it bathe, then it goes down. What it does is actually it just remove the pain. It just relieves the symptom. It doesn't change, it doesn't reverse whatever caries that has affected. So it's only like soothing the pulp. So the pulp is very irritated, the nerve. Okay, so coconut, probably whatever Ayurveda or any oil treatment is only to relieve the symptom and to cool down the pulp lah. So the problem is still there. Yeah, so there's no way in reversing. You still have to treat it. So the oil treatment is basically just to relieve the symptom. Yeah.
I see. Okay, thank you for the explanation. So it doesn't solve the root cause. It just elevate the symptoms. That's all. I see. Okay, thank you. Right. Any more questions from the audience? Okay, if there is no more questions, we shall end the session tonight. So thank you, Dr. Eunice Han, for a very interesting and insightful session. And we thank the audience as well for spending your precious time with us tonight. So I hope that everyone benefits from today's talk. So see you around. Good night and God bless.